Mindfulness-Based Relapse Prevention is an 8-week manualized outpatient aftercare treatment program for people who are suffering from substance addiction. Drawing on traditional meditation techniques from Buddhism, mindfulness-based relapse prevention attempts to help people overcome their addictions by increasing their awareness of their thoughts related to triggers, cravings, and urges, and to observe them until they pass naturally from awareness. Mindfulness-based relapse prevention was originally developed by Dr. Alan Marlatt, a leader in the field of harm reduction and relapse prevention therapy. Having practiced transcendental meditation for much of the latter half of his life, Marlatt began researching the possible applications of transcendental meditation as an intervention technique in the early 1970s, with a small preliminary study for high-risk college student drinkers. In the late 1970s and early 1980s, Marlatt turned his attention to Vipassana meditation, a meditation technique which has served as the foundation of many of the mindfulness meditation techniques used in psychology today. The Vipassana tradition of meditation is centered around the Four Noble Truths of Buddhism. The first truth is that life is full of suffering that is the result of physical, emotional, and psychological distress. The second truth states that the root cause of suffering is craving pleasurable experiences and avoiding unpleasant ones. The third truth states that in order to overcome suffering, one must cease craving and avoiding unpleasant experiences. The fourth truth describes a path by which to overcome craving and avoidance. This conceptualization of the human condition echoed Alan's understanding of addictive behaviors as well as his understandings of how to overcome them. Before Marlatt, the traditional disease model of addiction suggested that a defect in a particular organ, in this case the brain, was the cause of symptoms. One possible mechanism for such a defect involves the dopamine D2 receptors in the brain. According to this theory, individuals who have a lower dopamine response are more impulsive and seeking of short-term reward behavior. People who have a genetic propensity for fewer D2 receptors are naturally more impulsive and more vulnerable to addiction. Cognitive behavioral therapy, the theory to which Marlatt described, proposes a different model. According to this model, substance use is a learned behavior. When individuals struggling with substance use are presented with a high-risk situation, they react by either engaging in an effective or ineffective coping response. If they engage in an effective coping response, their sense of self-efficacy increases, and their probability of relapse decreases. If they engage in an ineffective coping response, their sense of self-efficacy either decreases and/or their expectation of a positive outcome from using their substance of choice increases. These beliefs then lead to the use of the substance as a coping mechanism. If individuals view this lapse as a minor mistake or as a learning opportunity, they may return to attempting a more effective coping technique in the future. If individuals view this lapse as an uncontrollable failing on their part, their probability of relapse increases. Mindfulness-based relapse prevention takes this cognitive model of addiction further, suggesting that lack of awareness, automatic responses to stimuli, and judgmental thinking are all states of mind that lead to craving, negative affect, reactivity to stress, and substance use. Unlike cognitive behavioral therapy, mindfulness-based relapse prevention does not try to alter thoughts about addiction. Rather, it encourages individuals to simply notice thoughts as they come and let them pass as part of the normal process of thinking. By increasing awareness, decreasing automatic responses and judgmental thinking, and increasing kindness and self-compassion, mindfulness training can reduce the probability of a high-risk situation from occurring, reduce reactivity to phasic risks, and prevent substance use. Mindfulness-based relapse prevention also theorizes that mindfulness training can help prevent the likelihood of relapse by blocking the progression of one stage of addiction to another, as indicated by the X on the dashed lines presented here in this slide. As for effectiveness, in the largest controlled study of mindfulness-based treatment of substance abuse disorders versus treatment as usual, which involved psychoeducation, 12-step programs, and relapse prevention groups, researchers found that retention rates for mindfulness-based relapse prevention were roughly equivalent to those of traditional treatment programs. What's more, individuals who underwent mindfulness-based relapse prevention treatments reported 5 times lower substance use 2 months following treatment, significant increases in mindfulness awareness and acceptance, a decrease in experiential avoidance, and significant decreases in craving versus the treatment as usual group, which experienced no significant decrease in craving. A 45-year-old single man presents to the emergency department after having fallen off a roof that he was repairing. He fractured his right tibia and severely sprained both ankles. The admitting nurse smells alcohol in his breath and orders a blood alcohol test, which shows a level of 230 milligrams per deciliter. The patient admits to having had, quote, a couple of beers, but denies being intoxicated and reports that he slipped on wet roof shingles. He states that he drinks a six-pack of beer daily after work and more on weekends. Typically, he drinks after dinner and then falls asleep. He denies that alcohol is a problem for him, stating that he has never missed a day of work due to his drinking and that he has been able to stop for up to a week without experiencing any problems. However, he admits to having bad hangovers on Monday mornings and has experienced blackouts, alcohol-induced amnesic episodes, and an arrest for driving while intoxicated. The man in this particular vignette presents with the following symptoms of alcohol use disorder. A great deal of time is spent in activities necessary to obtain alcohol, use alcohol, or recover from its effects. Recurrent alcohol use in situations in which it is physically hazardous. Given that the man is only presenting with two symptoms, I would diagnose his current addiction severity as mild. In an interview regarding the use of mindfulness-based relapse prevention in treating clients, Marlatt described the need to identify which of the 6 stages in the habit-changing process the client is currently in: pre-contemplation, contemplation, preparation, action, maintenance, or termination. In this case, the client is in the pre-contemplation stage of change, where he doesn't see his drinking as a problem. According to Marlatt, a sensitive health professional who encounters this sort of resistance to change must first engage the client in a motivational interview, where they explore the barriers that prevent the client from considering change and what the client's expected outcomes of behavior change are. One of the primary techniques used in motivational interviews is OARS. This involves asking open-ended questions, using affirmations, reflective listening, and providing a summary of clients' thoughts. Through the use of OARS, therapists are attempting to identify which of the 5 basic needs, survival, belonging, power or self-worth, freedom, or fun, that motivates clients to change. Assuming that the therapist is able to identify this client's motivation for change and is able to help him move from the pre-contemplation to action stage of change, the client can move into treatment. Treatment using mindfulness-based relapse prevention involves enrollment in an 8-week manualized outpatient aftercare program. Each session exposes clients to a series of cognitive behavioral skills, coping skills, self-efficacy, and recognizing thoughts and feelings that typically arise before relapse, used to increase awareness and reduce probability of relapse. In addition to cognitive skills, mindfulness-based relapse prevention treatment progressively exposes clients to a wide variety of meditation and awareness exercises, a few of which are presented here. Typical treatment involves the incorporation of these cognitive skills and meditation techniques as presented here. Marlatt's pioneering work in the development of mindfulness-based relapse prevention represented a profound shift in the way psychology conceptualizes the treatment of substance abuse disorders. By helping clients to recognize that awareness of thoughts rather than avoidance of them is the key to addiction control, he helped people realize that addiction is not something they have no control over, but rather something that they can overcome through the power of mindfulness and self-compassion.